Hello to all my wonderful obstetric colleagues. Lana here. I'm one of the midwives working on Badgernet at the moment. I have a new form for you to use. So you guys have been doing really well using Badgernet, but we do need to change the way we record our reviews slightly in labour. This has come from a review of how we're doing things for CNST. We used to, during when starting someone on syntocinon augmentation, we would start we would have a sticker in someone's notes and be able to tick off from that form to say that we had reviewed, that we've written the prescription, we talked about everything. And there would obviously be a point for the midwife as well, just to make sure everything's done before commencing the augmentation. We now need to use a form on Badgernet to be able to capture that information, as at the moment we don't have a way of doing that. So to do that, we need you to use a slightly different form rather than using the specialist review. So it's found in a similar way as you would the specialist review. So if we go to enter new note and we search for intra, and it comes up with obstetric intrapartum review. So this form can be used and should be used for all intrapartum reviews. So by all registrars and all consultants. This is obviously for us to be able to look at things as a whole. It will give us a holistic view, and also using our SBAR as a structure as well for those reviews. So we can see the form from here. Obviously, not being a doctor, it would normally be one of you guys that fills in conducted by, but for this case, I'm going to fill my name in here. You can add in whether they have a named consultant, if they are under any other joint clinician. So you could always put a midwife, or if there's anyone else. Our location in this instance is labour ward. So our situation that I'm working from here is a test patient, which I have set up to be post dates. They've come in for their second part of their induction. They have already had a outpatient PROPES for 24 hours. They shrommed overnight, came back in and are not contracting at this moment. So it has been decided that they are to start oxytocin augmentation. So they have a cannula in situ and they have just had an epidural sited and they are on a CTG ready and waiting for the review. So as I look further down this form, we can see part of our SBAR. So this is generated partially from what's come through from Badgernet, and partially if a handover has already taken place from midwife to midwife. If this isn't the first time this obstetric review form is being used, what has been written in before will be here and showing. So it means that we're not having to repeat the SBAR over and over again, and it reduces the amount of writing time that we need. So in our situation, obviously, that first line has been generated already by Badgernet. So it says our reason for induction is post dates, because I have filled in a separate form to say that this person is having an induction. I've then added a bit more information saying that they had an outpatient PROPES, what time they had it, and that they then shrommed at home, and the time that they did. That SHROM is also at the side here, which when you look at Badgernet on the iPads, at the bottom you will see a separate tab which says info, and on that, on the other side behind the form, will be more of this information that we can see down the side here. As we scroll down, we have our background, so you can say that you've obviously noted the background, and I have also written out the patient's medical and obstetric history. So we have that there. And anything can be added and adjusted as needed. This is obviously our section for you to write your review of the situation. The more recent observations will show here if they have been done recently. If they haven't, then once a midwife has filled that in, that will then come up in this box as well. So any recent bloods would show, and any recent blood pressures, temperatures, but I haven't actually done any on this patient for a little while, which is why it's blank. As you go down, you have space to be able to record the fetal heartbeat, any abdominal palpations that you undertake. If you perform any vaginal examinations, those can be recorded in here, including images of the fontanelles if you wanted to, if you were obviously sure of what we needed to. So we can refer back to that later. And that image will still be available afterwards. I believe some of you will know about this diagram possibility, but if you don't, then that's very helpful. As we go down, we've already got our membrane details pre-populated because I filled in the form to say that the person had ruptured their membranes earlier that day, so it's something that we have there as a reference. This next section is the most important that I need to draw your attention to. So this is what is happening regarding oxytocin. So this is what we need to be using to replace those sticky labels that we used to use in the handheld notes. So we need to go through and say, okay, we've discussed the risks. The person is agreeing to the decision, and obviously we can then mark whether we have discussed that plan with a consultant or not. Obviously that is potentially not appropriate or not required, but it's there if needs be. You then have the ability to be able to review a CTG, so you can do that as required, and comment on obviously on the fetal heart here, and make any additional comments. As we go further down the form, we've got our space for our recommendations as part of our S-bar. So we have our risk factors. This is what is generated from what the midwives have already entered. If we have missed anything and you spot something, you are welcome to add anything. So this person now has an epidural in situ. So if you see that before we do, you can obviously add that in. So I've started epidural. We've got intrapartum risk factor, epidural analgesia. Select that in there, and that is added as well. And then we can state whether this person is normal or high risk. Obviously, as they're starting augmentation, we will say they're high risk. This place at the bottom is for where we can write what our actual management plan is for the patient. So, for example, be in 4 hours from regular contractions or 6 hours post start. Oxytocin, sorry, oxytocin. And we can add any tasks if we need to as well. That's not something that we do routinely, but it's there as an option. So we can then do save and close. We've added our extra intrapartum risk factor here. If we go down here, we've also got an extra management plan there. So what we added in, and it's a good reference point for us as midwives to look back at. Also, when we then need to go back in and do the next review, we've got our obstetric review. So go back to the form again. So what we've previously entered, so for example, our oxytocin review, that stays in there, so that won't change, which means that we've already recorded that we've had that discussion. And you can see that the management plan is still there from the last one, and it's obviously said that it's copied from the last OBS review note, and you can add anything as required. I hope that's helpful and makes sense. If there's anything that you feel is missing, please feel free to contact myself or any or our Badgernet email address, and we can have a little look at anything. And I will check back in with you guys in a couple of weeks to see how you're getting on with the form. Thank you very much.